So on the right side, so I position myself on the left, so what I want to do is roll her into me. And so I'd kind of feel, again, where that junction is of her C7, T1. And I'd come off to the right side, just off to the right of T1. So I'd kind of put my thumb joint kind of right under, or right on top of that aspect of her joint, and I'd roll her back over my hand. And what I'm looking at is a little bit of a downward pressure just to see, again, if that feels stiff or it's painful. I would explain what I'm doing, ask her for consent, and then before we actually do the treatment, I would kind of hold and overpress that position for around 10 seconds just to make sure she's not getting any head, neck, or shoulder issues. And if that's okay and that all clears, then we'd actually let her relax for a second, introduce that same pressure, and I'd actually have her twist or rotate her head to the right, apply a little downward pressure, and then I'll actually give her a little bit of a push, and then you get actually a couple things to crack or cavitate. That means the joint maybe was a little stiff, that it needed to get pushed, and after that, then I would come up and have her sit up, and do the same thing that I did right away, was put my fingers right on those joints again, and then have her rotate to the right, and then hopefully, if that was a stuck joint and it wasn't a muscle restriction, it would hopefully restore and move in its normal symmetrical position, just like she would looking to her left. Another thing we can do as well in this position is to actually come more off to her other side. So let's go on your back quick.
Okay.
And if we're just thinking it's that right side again, another example is I'll use her left as an example just for you guys to see. But what I'm looking at here is to go right offset to that C7T1 again. I'm going to use kind of my second MCP as kind of a contact point on the left side. And what I'm doing is kind of being able to kind of lock her neck in by kind of side bending her slightly down and rotating her slightly down to kind of feel a little bit of a restriction and that I'm into that. And what I can do is also put a little upward pressure to create a little extension at that joint. And from there, overpress it, make sure she's okay with it and it feels good. And if that's okay and I got her consent, then I would introduce that again. And then again, I'm not pushing down with her head, I'm more supporting it, and I'm applying more pressure through my left hand. And then from there, if that feels okay, then I'll actually do a little bit of a push. Again, you may get a click or a crack. If not, doesn't mean nothing was done or something wasn't done. So then I'll have her sit back up and we'll redo some of the active mobility testing again. So these are just some of the ways that we kind of treat it as physical therapy. Physical therapists, and we just want to let everyone know that this is something we can definitely treat. So if any of this sounds familiar, give us a call and make sure you try to find a therapist that kind of feels comfortable doing these and that has a special interest in treating the spine. Okay, thanks.